One of the things that we've seen happen over the past 2 years is there's been an enormous amount of misinformation when it comes to general health care. And in this particular case, it's whether or not your body is capable of producing antibodies after you get COVID-19. And the mainstream media, if you follow them, you're probably wildly misinformed. And so in this article by the Epoch Times, we're going to look at some of the evidence that actually suggests that not only do you produce antibodies, but you produce antibodies long term, which we all know if you get information from the mainstream media, they told you the opposite. They told you your body's not capable of producing these antibodies, and that's enormously false. So let's break this down so that you can truly understand this, because this information that I'm about to share with you will help you make informed decisions on your health. But before we get started, I'm Dr. Nick Zarowski. Be sure to subscribe to the channel and remember to hit that notification bell, because if you don't hit the notification bell, you'll never know when new videos come out. And then also, if you want to get my whole library of natural health videos and you truly care about taking control of your health and doing it naturally, go to www.drzee.tv. Let's dive into this study. In the study, researchers began with the understanding that protective antibodies are generated by long-lived bone marrow plasma cells. Okay, this is important because this is the way it's been, this is the way it's always been, and this is what we know through health science. We've seen a lot of health science kind of flipped on its head over the past couple of years with just new made-up stuff coming out by the media and being interpreted as truth when it's in fact false. They noted that the research in 2020 reported people who were infected with SARS-CoV-2 showed a rapid decline in serum antibodies in the first few months after the infection. Now, the question the researchers sought to answer is whether this reduction in antibodies indicated the bone marrow plasma cells generating immunity against the virus may also have been short-lived. The researchers engaged a group of 77 participants who had mild COVID-19 infections. The group donated blood samples at 3 months intervals, beginning 1 month after they had recovered from their initial infection. 18 of the participants also donated bone marrow approximately 7 or 8 months after the infection. The 5 came back 4 months later for a second bone marrow extraction. Now, this is a way that they actually go and look at whether or not you're creating antibodies. They do these bone marrow extractions, and they're actually quite painful, people tell me. So it's not something that these people enjoyed going through this process, I'm sure. As the researchers expected, the levels of antibodies in the blood dropped quickly within the first month. However, some of the participants had detectable antibodies even after 11 months. The testing showed 78% of the bone marrow samples had antibody-producing cells from SARS-CoV-2. Researchers also tested bone marrow of 11 people who had never had COVID-19. In their bone marrow samples, there were no antibody-producing cells. So what the team concluded is that these bone marrow plasma cells remain inactive or sleeping, but they didn't disappear, indicated they are part of a long-lived immunity. Now, this is something that's very important, and when I first heard this information, once again, I'm just a common sense kind of person. I look at what's happened in the past, and I know that the science just doesn't magically change. We're biological creatures. Our genetics haven't changed. Why is it that we can look or let's say that we could ignore old science and act as if it doesn't exist? So one of the things I kept referencing was the Spanish flu, 1918. They did this study where they took individuals who were over 90 years of age, and they tested them in the same way that they're testing people right here. And what they found is that these older individuals, over 90 years old, still had antibodies to fight the Spanish flu. So if for some reason the Spanish flu came again, their body basically stores this information, and then when the immune system identifies it, it goes, oh, we know what this is. We got this in the memory bank. We're coming out to kill. We're going to do our thing. Because the immune system is incredibly powerful. And I know, the mainstream media wants to act as if you don't have an immune system. They want to act as if you're not capable of producing these antibodies, and know full well that these mainstream media outlets are funded mostly through these big pharmaceutical companies. When you look at big news anchors, they are sponsored by big pharmaceutical companies. So I would say that they have a stake in the game at convincing you that there's no way that you're capable of producing natural antibodies to fight this off. So when we heard all these reports, one of the things I did, I go, nope, can't be true. Can't be true. It's not possible. It's not the way the body works. Okay. It's not that I had all the science laid out and all the future science and all that knowledge in my head. It's just that I looked at what has happened in the past. And when something we know scientifically happens in the body, in all of these other instances, we know it's going to happen again because that's what the body does. The immune system didn't just rapidly change over the past years. Just because they decided to change the definition of what immunity is to being something where you build immunity after you get a virus, to the only way that you can actually build immunity is by getting a vaccine. Just because they decided to change their definition, it doesn't change all the years of science that we have. Now, overall, the article goes on to say, we show that SARS-CoV-2 infection induces a robust, listen to this again, a robust antigen-specific, long-lived humoral immune response in humans, concluded the researchers. Now, the senior author of the study, Ali, an associate professor of pathology and immunology at Washington University School of Medicine in St. Louis, pointed out one flaw is assuming natural immunity against COVID-19 had waned by measuring the antibodies in the blood. So what she's saying is that, like, look, you measured the antibodies in the blood and they just weren't there because these antibodies basically, they basically go dormant. They have no reason to be at high levels just circulating throughout the body because the body didn't need them at the time. But I can tell you right now is that, this information that was given by the media, it specifically fit their narrative. So that's why it was so popular. Last fall, there were reports that antibodies waned quickly after the infection with the virus that causes COVID-19. The mainstream media interpreted this to mean that immunity didn't live any longer within the body, but that was a misinterpretation of the data. It's normal for antibody levels to go down after the acute infection. As I mentioned, they don't need to be surging through the body. There's no reason for it, but they go down, but they don't go down to zero. They plateau. So here's the thing, is that we have to make sure that we understand the true information. And I'll get to just in a minute why this is very important. In this article, they go on to say, according to the researchers, here we found antibody-producing cells in people 11 months after the first symptoms. These cells will live and produce antibodies for the rest of the person's life. That's strong evidence for long-lasting immunity. So here's the thing that they even go on to point further. These cells are not dividing. They are inactive, just sitting in the bone marrow and secreting antibodies. They have been doing that ever since the infection was resolved, and they will continue to do this indefinitely. Okay, so this is wildly, wildly important because now that you have these antibodies within your body circulating or just staying inactive within the bone marrow, your body knows what to do next time you come across COVID-19. Once again, there's this big narrative going, well, there's going to be this coming and that coming, and the only way to protect yourself is through the vaccine. It is not true. That is wildly false, and that is misinformation that is being pushed by those who seem to have a stake in giving you that misinformation. Let's just leave it at that. I want to go down a little bit because one of the things this article goes on to say here is that before COVID-19, it was acknowledged that a natural infection nearly always produced better immune response than the actual vaccine. The argument for vaccines was that it reduced the risk from diseases that may produce long-term disability or death, such as birth defects, rubella, liver cancer from Hep B. Now, this is the thing that is wildly important. It's important to understand, and this is very clear in the science. The medical profession knows this. The science community knows this, that there's no such thing as a one-size-fits-all approach for anything. You can't make, for instance, a vaccine and then every biological creature, these human species amongst us, it's not going to literally work the same way for everybody. There's going to be people who have tremendous negative effects. There's going to be people who don't need it. There's going to be people who may benefit from it. And there's all these different outcomes you're going to have. And so just like if you had a nutraceutical, as in vitamins, if you had a medication, or if you had a vaccine, It is not a one-size-fits-all approach. Let's stick with medication. You just give you have a particular medication, you give that to everybody, you blanket it with them. We know that that doesn't work. And the reason for it is because genetically we're all different. And when you look at the field of genetics, we know that if it's, even nutrigenomics, where you're looking at your nutrition in your genetics, or if you're looking at medicine in your genetics, we know that certain medications literally just don't work well for certain people because of their genetics, or certain nutrition practices don't work well for people because of their genetics. Do you think we should probably ask the same question about a shot? Absolutely. Absolutely, this should be asked, but nobody seems to care. And in fact, people in your government, your basically celebrity figurehead doctors who have never practiced a day in their life and really don't have patient experience, they are telling people it's a one-size-fits-all approach, and it's not true. It's not true. You'll have some very negative outcomes from this. As we go on in the article, but the same can't be said for SARS-CoV-2. Vaccines against COVID-19 may not be a necessary health risk for many, especially when you consider the following. Robust scientific reviews and multiple clinical trials have suggested the use of things like ivermectin that could help for COVID-19 and be very useful. And they also are talking about natural immunity against the COVID-19 as well, and how that's very useful. Now, this is a part that I think is probably the most important part that I'm going to talk about here, and that is a doctor warns that if you've had COVID, you may not want to be getting the shot. And this is important because, once again, there's very clear scientific evidence that tells us, look, you may see very negative results when people who have all these antibodies in their body and you go and inject them with this shot. One international survey of 2,002 people found those who had recovered from COVID-19 illness and received the first dose of the vaccine experienced significantly increased incidence and severity of side effects. Okay, this is what nobody's talking about. Why is this information not being put right at the forefront? Hey, everybody, look, if you already got it, maybe you shouldn't be going and getting this shot. It's just something to consider. It's not even a maybe or a if you had this. Nobody's talking about it. Nobody wants to give you that information. These side effects include fever, breathlessness, and severe effects that led to hospitalized care. I take care of many people in the healthcare profession, and one of the things that I keep hearing is we keep having individuals come in who are having myocarditis, they're having inflammation within their heart, and in fact, there was an individual who told me that in their unit, in this specific unit that they are working in, they had somebody who is paralyzed from the waist down due to getting the shot. Okay, this is something that is very important because the number of side effects is being wildly underreported. Once again, nothing to see here. Nobody wants to talk about it. Retired cardiac surgeon Dr. Human, a strong proponent of vaccination programs, has raised concerns about the unprecedented nature of the COVID vaccine program. So here's the thing that's important, is that they go on to say in this article, he's a strong proponent of a vaccination program. However, he is a doctor and he has a brain, and he took a Hippocratic oath to go in and make sure that he is not doing harm to people. So this would be a pretty reasonable approach to say, hey, we might want to take a look at this and see if something's wrong here. So basically, he's a strong proponent of the program, including the fact that the public health authorities are recommending people who have recovered from COVID-19 still get the vaccine. He believes that questions should be asked about specific vaccines and their potential side effects. This doctor has written multiple letters warning people should first be screened for the presence of viral proteins before the vaccination. In one letter, he warned that without a screening, this indiscriminate vaccination is a clear and present danger to a subset of already infected people, right? So you have people that are just showing up to the CVS pharmacy. They don't know anything about these people, just giving them the shot. People showing up to Costco pharmacy, getting the shot. They don't know anything about, what about these people's health history? You know what I mean? This idea that you can just go and blanket people with this is very dangerous. Okay, I'm not saying that, I'm not even going and saying that the vaccine itself is dangerous. I mean, that's not what I'm making known here. What I am making known, though, is that it is a very dangerous practice that's being used. And please understand this, that you have to make decisions for your health. I have a lot of people who are saying, oh, so and so pressured me to get it, or my workplace pressured me to get it. You are the only one responsible for you. So therefore, when you go in and you get the shot and you sign the paper, the waiver that basically says, I take full responsibility based off the information that I know, that whatever happens to me, and you do this, by the way, whatever happens to me post this shot, I am responsible, and I accept that responsibility. And I know beyond a shadow of a doubt that COVID is far more, just getting it naturally is far more dangerous for me than getting this vaccine. And so you sign that paper, and then if something happens to you, understand that there's no going back, there's no litigation, there's no suing. These companies are protected by the federal government. So at this point, you're responsible for your decision. If you made that decision, you now get to live with that decision. And it is my opinion that any of these organizations, these companies, these stores, whoever, that are basically pushing their employees to go and get vaccinated, they should be held responsible. I think that it is they should be required, first of all, to carry malpractice insurance because they're giving healthcare advice. They're literally acting as a doctor. If your company is telling you you have to get it, that company is now acting like a doctor, and they're giving healthcare advice, and they should be forced to either carry malpractice insurance or they should be held responsible because they told you to do it. The other thing I want to point out is that your health information is your private information, and you don't have to give that up to anybody. I heard somebody go to a restaurant recently, and they literally said, make your vaccine cards, make sure that they're available. Like, as in, like, if we decide to ask you for them, we have a right to see that information. Nobody has a right to see this information. In the government, there's protections made so that people don't have to willingly give up their health information. It's called HIPAA, and it's designed so that you're not discriminated against, okay? And a lot of people, they don't see the long-term negative impact of just giving your health information out to people, right? Because they just think, oh, vaccine good, vaccine card good, give it to people good. No, very bad. Because you, at this point, are participating in a very slippery slope. What if you decide to go get a job one day and they say, hey, we want to see your health information, and then they discriminate against you because maybe you had a heart attack earlier on in life? I'm in clinical practice. I know the dangers of giving any information. In fact, if somebody was to come into the clinic, and let's say it was the wife there was a married couple, say the wife came in, and then the husband came in later in the day, and they didn't know each other. They didn't know that each other came in the clinic because they have busy lives. And the wife comes in and says, was my husband here? I can't tell her that information. How silly is that? It seems like so silly because it's like, well, I mean, it's her husband. Why can't I give her information whether or not he showed up or not? I literally can't say that. That's illegal for me to say that information because that's what HIPAA does. It protects people. It's not for us to say. We cannot answer questions about other patients, even if they're in a marriage. So these other companies have no right to ask you these questions. So take that into consideration, protect your personal health data, and check out the other videos on this channel.